Our Puentes Esperanza cross-jurisdictional sharing project is aimed at trying to promote cross-jurisdictional sharing between San Diego County, Imperial County, and the state of Baja California to try to improve health outcomes in the area of tuberculosis. Tuberculosis is a challenge in our border region. Baja California has the highest incidence of tuberculosis in all of Mexico. Imperial County has the highest incidence of tuberculosis in all of California, and San Diego's rate is over double the national average. So we have a real incentive to try to work together to try to bring down the incidence of tuberculosis, and we realize the only way we can do it is if we work together. And in this era of declining government resources, we increasingly need to look at philanthropic partners and private partners, which is why the foundation that I head is now leading this effort to try to bring these various parties together towards a common solution. Over the next 2 years, our hope is that we can forge an interjurisdictional partnership that's cross-border. We need an MOU that we can get the various partners to agree upon, develop meaningful metrics that we can get some common agreement on, and then ultimately try to begin looking at improving the health outcomes in our respective jurisdictions specific to tuberculosis. We have a lot of work to do on that front. The public resources are actually in decline in this area of infectious disease control. So we need to also look at bringing other philanthropic partners. We're looking at bringing together the Imperial County Community Foundation, our sister foundation in Mexico, as well as other private funders to get involved to support the public institutions that are trying to deliver care in this area. I would say one of our biggest challenges is overcoming the political and cultural barriers that exist in our border region. Because our project is binational, and it's the only binational project as part of this sharing learning community, we feel that that's an area that we really do need to focus on. Oftentimes in our border region, people focus on the differences and not on the commonalities of purpose, and so that's definitely one area that we want to try to focus more attention on. Another big challenge that we face are political changes that are on the horizon. In Mexico and in Baja California, they're going to have an election in July. So our goal is to try to affect change as quickly as possible so that we can gain some consensus with the current administration and have some of those commitments stick with the new incoming governor. So those are some of the challenges we're trying to face in Mexico. But one of the things I think that we want to emphasize is that in spite of all of the differences that we have between our countries and between our jurisdictions, an infectious disease like tuberculosis knows no political boundaries. And so one of our goals in this project is to get our elected officials and our civic leaders to understand why we need to work together and come together to solve public health challenges like those related to tuberculosis.